everybody. Look who I found in the desert. For those of you who don't know her, Ribeye Rach, and you can find her at Instagram at Ribeye Rach. But Rachael is here with me, and she has such an amazing story of healing that I wanted to share with a lot of you, especially for those of you who are struggling with Ehlers-Danlos syndrome, upper cervical instability, hypermobility, POTS. She's been through it, and I'm so excited. I'm so excited actually to be with her. We just went for a hike, and it's so amazing to celebrate health, vitality, because I know you were basically bedbound as well. I saw pictures of you online with like these full neck casts, and anyway, so welcome, Rachael.
Thank you. I'm so excited to be making this video with you.
Yeah.
So I guess to give you a brief overview of my chronic illness story. So when I was about 20 years old, I became very sick, and throughout my childhood and teenage years, I had signs of chronic illness and nervous system dysregulation. But when I really had my perfect storm was when I was 20 years old, and I was in college at the time, and throughout the years I was diagnosed with Ehlers-Danlos syndrome. I was diagnosed with dysautonomia or POTS, Chiari malformation, spinal instability, craniocervical instability, and just like overall joint instabilities, as well as gastroparesis, intracranial hypertension.
I didn't even know any of this.
Disease. Yeah, I know we have chronic Lyme disease in common.
Okay.
Yeah, and just the list kind of goes on. And for years I went down the Western medicine path. I tried all sorts of different medications and treatments, and I continued to get sicker. And at some point I actually was recommended to have major neurosurgeries. And so I had, I think, 5 major brain and neurosurgeries, and I continued to get sicker. I was at my sickest a year after those surgeries, and I was continuing to decline, and my doctors were actually recommending that I have more neurosurgery, and something inside of me it didn't feel right.
What were the surgeries for? What were they trying to correct?
They were trying to correct craniocervical instability. So I was fused from my skull to C2, and that was supposed to help with cervical instability. But I actually, after that surgery, my instability became worse, and I became more reliant on my neck brace, and it really just didn't fix the root cause of the problem. And of the many people that I've encountered that have had that surgery, I haven't met a single person that has, that has been the big thing that has helped them recover. And so I continued to get sicker, and I also had stents placed for intracranial hypertension, high brain pressure, but it didn't help. I continued to have like spinal taps, and they were still high, and I had the Chiari decompression, and my the herniation on the scan actually, it didn't improve with the surgery.
I can't believe that you're the same person that's describing all. I mean, this could completely ruin somebody's life, like for their life.
Yes.
And
here you are. And I also had the tethered cord surgery. And interestingly enough, when I had that surgery, my surgeon said, "You had one of the worst tethers I've ever seen." He took pictures of it for his neurosurgery colleagues. And so maybe I'm in a textbook somewhere. I don't know. But I didn't see any improvements from the surgery.
Wow.
Not any at all. And I'm not going to say like it's impossible for somebody to find an improvement from a surgery, but I was just so sick that I couldn't handle that, and it just kept making me sicker. I got infections. I had to stay in the hospital for I had to have surgeries for infections in the incision and stuff.
About how long ago was this?
So this was 5 years ago now.
Okay.
Yeah. So long time. But so my last neurosurgery was 5 years ago, and I think the first one was around 6 years ago. And so at about a year and a half after these surgeries, I was at my worst, and I was just completely debilitated, bedbound, so sick, and every day I was having episodes that would undoubtedly take someone to the hospital, but we'd go to the hospital and they wouldn't be able to help. And so it was just, I felt so unsafe in my body, and I just felt like I was constantly in this emergent state and nobody was able to help me, and that was a very scary thing, which I'm sure you can relate to. And so at that point I kind of just decided I don't know what I need to do, but I need to go down a different path because I am not getting better. I'm getting sicker, and there has to be another way. And so in time, God kind of led me to these different things that have helped me in my healing journey. And one of the first things that I did was I changed my diet, and that really, really helped. I did a heavily meat-based carnivore diet for about 8 months before I started brain retraining, and that really helped. And it was, everybody that's sick wants to find something that's going to heal them overnight, right? But you can't go from bedbound to fully healed in a month. I mean, not going to say can't, but it's not common to be able to heal that quickly. And so just very slow and steady improvements with that.
What do you think so many people ask, what is it about that meat-based diet, in your opinion, that helps people with hypermobility recover? I have thoughts, but I'm curious about yours.
Yeah, so I think that the collagen in the meat-based diet, whether it's slow-cooked meats or bone broth and that sort of thing, and just the protein itself is really, really helpful for people with connective tissue disorders. I'm not talking about like a collagen supplement. That can be helpful. I'm not going to say that it can't be helpful, but really getting home-cooked meals and that have that are rich in collagen can be super helpful. And for me, I just gradually felt my body strengthening and that strength just increasing. And I think there's a big component of insulin resistance as well. And actually, I don't know if you've dove into this, but insulin resistance drives the fight or flight response of the nervous system. And so it's just so cool how it's all connected. But I think balancing my blood sugar, because I did have, that was another thing that I was diagnosed with, was I had hyperglycemia, but I actually had signs of like autoimmune diabetes, and I was testing like in the 200s for my blood sugar at some point.
Amazing.
So just it's been a wild experience, but that was kind of my first thing that I did that really started to help. And then after that, I think it was about 6 to 7 months into carnivore, I got prolotherapy treatments. And so I went to Florida and I stayed there for 6 weeks, and I had prolotherapy treatments on my neck. And at this time, I was still kind of in the mindset of, I need to find somebody to fix me. And so if I were to go back, I don't know if I would have taken the same path, but these treatments definitely were really helpful for me. And they especially helped with the stability of my neck. And when you have a spinal fusion, you're more prone to having more instability because of the extra pressure and not having that natural movement.
Isn't that ironic? You get a fusion and then you're more prone to instability. And I saw that as a physical therapist. It was like we'd get those patients and it didn't do what they were hoping, because then they had instabilities elsewhere and the body trying to compensate in a whole new way. And then, what it does to the brain, like the brain is constantly registering what's happening in our neck. And if it's like a whole new system, it's going to drive fight and flight.
And especially those people that are prone to having connective tissue disorders and having that weak collagen, lax ligaments, like jumping to a fusion just seems like a tough thing. And if I were to go back, I wouldn't have it, but I do think it's a part of my story for a reason. And I've actually had quite a few people say that they've been able to heal because of what I shared and not have to have the surgery. And so I think maybe that just was my purpose with it. And so
can I pause? I mean, even for me, I was diagnosed with upper cervical instability, severe transverse ligament instability. This last fall, I had a bunch of stuff happen, perfect storm. But the guy was like, yep, okay, well, it's super unstable. We can try chiropractic, but I'm probably going to send you to this center where they're going to look at fusion. And I'm like, what? And I actually knew about you. And so that was one person I'm like, no, I'm so not going down that road. I mean, I'm doing great now, by the way. Like, it's crazy how, I'm sure it helps some people, but again, I knew about you then.
It's interesting because I was told that was my only option, and I actually asked about prolotherapy, and they told me that was more dangerous. Which now I'm like, okay. But so it's just interesting because it's not even the severity that I've seen people from the worst of places, TPN, bed pound, full-time neck brace being able to heal through nervous system work and often diet as well. And so I think even though a doctor says this is the only way, it doesn't necessarily mean that that's the case. And so it's hard to navigate, but it's not a fix. I think that's one of the things that I want to share is it doesn't fix the root cause of the problem, and it doesn't come without risk. So
wow. Well, I'm so grateful that you recognize to stop that path that you were on. I think that can become a slippery slope where when the doctor says you do, the doctor says you do.
Yes.
And they're well-meaning. It's not like they're trying to ruin your life, but that's just what they know.
Can.
And a lot of them don't understand a lot of the science behind why the collagen starts to unravel. Is there an inflammatory process happening? Is there some type of mast cell thing happening? Is their blood sugars unstable? Are they not able to absorb amino acids? Like, what's their energy, their energy field? Like, there's so many factors that a lot of doctors just aren't trained in.
Yes, absolutely. And I hope that will continue to change. It seems like more and more people are kind of being aware of these other options. But for me, I think something interesting to note about the prolotherapy is that some people, I think, are so dysregulated that prolotherapy can actually make things worse. And so it's just an interesting balance. I think what I did with diet, where I kind of became a bit more stable before going for the prolotherapy, I think that really set me up for success when I did have prolotherapy, because I was kind of able to handle it. I was in a bit more, I was still very dysregulated, but I was, on the path to regulation. And so I think that was probably a really helpful for me in the success of that. And I always like to say it's kind of hard when sharing about these things because these are things that not everybody has access to, that not everybody can afford. Often these things are not covered by insurance. And so it's kind of an interesting balance of, yes, it did help me, but I do think that I could have found healing elsewhere, and there's always multiple paths to healing. And one thing that was really telling for me was that, I only had prolotherapy treatments on my neck, but I had major jaw issues. I had, spinal issues, joint issues, just joint pain and instability, and everything else is healing. Like I'm stronger than I was before I got sick in many ways. And even just the being prone to sprain my ankle or something, I'm just not anymore. And it's so cool. And I've started climbing again, and I feel that I don't even feel joint pain like I used to.
So I love this.
So it's and so that to me, I don't want to discount the progress that it brought me. And I think a way to frame it is to say that prolotherapy helped it to accelerate my healing, and it was very supportive of everything else that I've been doing to heal. And I have seen people recovering without it, and so I don't want people to be discouraged if that's not an option.
And then how did the nervous system rebalancing work come into play, and what were all of the different ways that you worked on? Because I know that was another, we've been talking about all the medical and the diet stuff, but obviously we're all about nervous system work, so let's move to that.
Yes, of course, and that's the most important part of my recovery. And so after...
Wait, pause, did you hear that, folks? That's the most important part of her recovery. Yes. Take note of that while you're thinking about all of these other solutions to fix. So thank you for highlighting that.
And so I had heard of brain retraining actually 5 years before I started. I know Dr. Kat also talks about how long it took her to be open-minded and realize this was something that could really help her heal. And I was the same. And so I found brain retraining I think it was about 3 or 4 months after I started prolotherapy. Well, actually, I started it. I had been thinking about starting it for quite a while. And I started with the DNRS program, and I made really quick progress. I went all in, and I really believed it would help me. I had already kind of started implementing some nervous system brain retraining practices before, just telling myself that I was safe, telling myself that I was healing, and learning ways to signal safety to my brain. And so at this point, I'd seen so much progress, and it's kind of crazy to even think about because I was so sick still, at that point. And I thought I was doing amazing because I was out of bed for 6 or 7 hours a day, even though it was very low energy. I wasn't able to walk to the end of my mailbox after doing all these other things like the diet and and the prolotherapy. And so within a month of doing the brain retraining, I went from not being able to walk to my mailbox to being able to walk a mile for the first time in 6 years. And now last summer, I actually went on a 12-mile hike. And so I'm back to rock climbing. I live a normal life now, and just have gradually seen that progress, and it's been amazing. And like I said, nervous system work has been the most important part of my healing. And there came a point where with DNRS and just doing brain retraining where I felt like I kind of hit a wall, and I felt like I needed something else, because it was like my brain started to feel safe enough to process that past trauma that I was not ready for when I was in survival mode. And so when I got to that point, I kind of found different resources through Instagram and YouTube on somatic practices, and kind of implemented that. And I've also done a lot of other supportive things for our nervous system, like working on circadian rhythm and grounding, spending time outside in nature, and connection.
Let's time out real quick. Look what we both have on. Can you see this shoe? We just met each other for the first time. We both have the same grounding shoes. Harmony brand. I'm not an affiliate. Are you an affiliate?
Yeah.
Oh, okay. Well, she is. So she probably has a code.
Yeah.
I just like them. And we both had our Aura ring on.
Yes,
Sorry, I know
good.
I'm always interrupting things and going on tangents, but we thought that was so funny. We just
Yes.
had the same shoes.
We're like
on.
twins.
Yeah. Anyway, okay.
Yeah.
Sorry, back to grounding and
Yeah.
circadian.
So all those things have been super supportive of my healing. And I think when it came to brain retraining, the program that I started with, it was kind of like, stick to this program perfectly. That's the only thing you need to do, and then you'll heal. And that didn't resonate with me, and I was okay with that. That's what I kind of try to share in my videos about my experience with different programs, is that just take what resonates with you and leave the rest. And I think I even heard you say that in one of your videos, and I was like, oh my gosh, I say that all the time. So I kind of just made it my own, and from what I learned from different programs, I've kind of just made my own nervous system practice. And now I've just started going through Primal Trust over the last few months, and it's been really great. I'm going to brag on you for a second here, but I definitely think that so far from what I have experienced, it's been like the most holistic option that I have found. And it's just really refreshing, because I think whenever I recommend something like DNRS to someone, I feel like I have to have this long caveat of like, it's going to be kind of cheesy. It's, some things might not resonate with you. That's okay. But I really love that Dr. Kat embraces that our bodies have this innate ability to heal, and like the power is within. And that's something that I think, some of the other programs are lacking, and it's kind of something I picked up on my own on the way. But I just was so excited to find a program that I felt like really fits with everything I've been doing. And also I love that you have resources for processing trauma, because I think that's so common, because when you're in survival mode, you don't have the capacity to process that trauma. And once you start to feel safe, like for example with brain retraining, it's that past trauma just kind of comes back, and you don't know what to do with it. And that's where I was like, what do I do? I'm getting better. Like, I'm physically able to do all these things, but like I feel this like wave of trauma and grief over me. And so I just kind of learned to deal with that. But I love that your program implements all these different things that you can do to regulate your nervous system, because I think that's really needed. And it's very I'm just gonna brag on you. But I just resonate with it so much, because it's so real and relatable. And I love how you shared that like it took you so long to even realize that you needed to implement nervous system
very
work.
Stubborn,
And
very.
I think that everybody has that journey of like coming to realize that this is something that could really help them heal.
And to realize it's not just one tool. Like, just like you, I really had focused on brain retraining. Well, I also had focused on functional neurology for like 6 months, but then all of my childhood trauma came up, and that was not something that brain retraining was addressing appropriately at all. And fortunately, I had a background as a somatic physical therapist, so I knew like, okay, time to go in the body, Kathleen. No, I don't want to go. Time to go in the body. So there was even a struggle for me. Like, I wanted brain retraining to just take care of all the trauma,
but
it didn't. And so that's why I really Primal Trust was created originally for people to come to from brain retraining programs and go into their Primal Trust process. But now obviously we have it's also for people who've not done brain retraining as well now. But anyway, okay, I'm done with my caveat.
Where were we?
So you are healing, doing nervous system work. And then how quickly did that happen for you once you started the nervous system work?
I really started to see progress quickly, and I think maybe part of that was because I had already made progress in my healing journey, especially with my diet, getting my blood sugar under control, and that's something that I actually see as a part of nervous system regulation. And so that's why I do say nervous system work is what has helped me to heal, because everything fits into that. And so I saw progress quickly, and have just continued to heal. And I would say for me, the physical healing actually came first. It came quicker than the trauma and the grief and the emotional healing. I know sometimes people say it's the opposite. Everybody has a different experience, but for me, I felt like the physical healing and strengthening was kind of what came first. And even now, like 2 years plus into doing brain retraining and nervous system work, I still feel like I have a long way to come. But that's
a
just
life's journey.
Right?
I mean, I'm still doing trauma processing and healing. Like we're on a life's journey. We have new situations. Like now I run a business. Now you run a business. So so we're doing new things, and the nervous system has to learn to adapt to that. And I do believe these tools are. I mean, it's not like maybe we're not retraining like we were when we were bedbound, but they are still tools that are part of our life. It's a lifestyle. Like, I'm getting ramped up.
You are going to be dysregulated. Like, the goal isn't to be regulated all the time. It's to increase your resiliency and to know what to do when it happens.
Thank you for saying that. I think that, again, the ego wants to have this perfect standard that you do brain retraining and nervous system work, you become regulated, and that's just how you are in life. And I'm a wave person, and people know that. But I can come back into homeostasis. That's what I love. I'm dynamic, and that's really what health is to move in and out of trigger with ease and grace.
And what if it's okay to be dysregulated sometimes?
What if it's okay?
What if that's okay?
Yeah. And that's what makes you more likely to come back into balance, is that it's safe to feel the way I feel. It's safe to feel the way I feel, the fear, the grief, the shame, the whatever. There's nothing wrong with me. It's just part of that human experience.
All comes back to safety.
It does.
It really does, though.
And so another question I have, did you have any signs as a young person, as a kid, that you had this issue, and what were they for those that are listening?
So I would say that growing up, I had a tendency to have harder times recovering from infections. Like, I remember getting mono in 5th grade and staying home from school for a month or two, and whereas my sisters would just be back in like a week. And so it took me a long time to recover. I kind of had recurrent infections, and when I was 15 years old, I that was really my first perfect storm, because I was actually pretty sick in comparison to what I dealt with later. I don't see it as too bad, but it was significant, and I was experiencing like dizziness and fatigue and migraines, and I was diagnosed with celiac disease and ended up going gluten-free, and that helped for a time, but it wasn't, obviously, it wasn't enough in the end. But so I definitely had signs growing up, and tendencies of people pleasing, and
Were your joints, did you have any signs of loose joints as well?
I was always quite flexible, and I guess a little bit more prone to sprain an ankle or something like that. But I was overall a fairly healthy kid, just with a little bit more of a proneness to infection and slow to recover, easy bruising, just healing in general was slow for me.
And so now, would you say that you have the diagnosis of Ehlers-Danlos syndrome anymore, or what would you say?
I wouldn't, actually.
That's awesome.
Yeah, it's not something
That's what I wanted you to say.
It's not something that I identify with, and I think actually a part of my healing has been just letting go of those labels and realizing that healing is possible for me. And if a doctor told me that it wasn't possible, it doesn't mean that it was true.
Yeah.
And so I don't fit the diagnostic criteria anymore.
Wow.
And at least to my knowledge, and to me, it's just a checklist, a sheet of paper with a checklist.
Yeah.
And that determines whether you have a lifelong disease or not. That doesn't resonate with me. And it always didn't quite sit right with me. But it was validating to have this diagnosis. And I think in a way, it's going to get a little bit deep, but in a way, when you get diagnosed with something that's said to be genetic and incurable, it's almost like a relief.
Yeah.
It's almost like, oh, this isn't my fault, and there's nothing I can do. And so it's yeah, and it's hard because I don't want to say the wrong thing, but it's something that I think a lot of people have to work through, because I was always of the mindset that I would just do the best I can given this diagnosis. Yeah. But then I had this realization, I would say about 2 years ago. I thought to myself, no, I'm not going to just do the best I can. I can fully heal. And that took time to fully believe that. And it started with a curiosity, which I think can be really powerful. But it's, I definitely think that it can be really damaging for doctors to tell people that they have this incurable disease when it's literally they can't, it's just a group of symptoms they can't explain. And so to tell someone that you can't get better, and people believe that, and when that becomes a core belief, it's hard to overcome that.
Many of you know that a handful of months ago, my daughter was given the same diagnosis, Ehlers-Danlos syndrome, and I was like, stop. Because I don't want to imprint her that this is a life sentence. It may be a phase where she is presenting in this way, but I've seen too much as both a physical therapist, as a nervous system coach, and in this field where people with this diagnosis reverse it or at least make it a heck of a lot better. And I know that there's a lot of supportive communities for EDS and hypermobility, and while that can be great, I would ask yourself, is this limiting the belief of what's possible for me in this community? Because I joined one, I'm not going to say the name, to learn exercises, and the way she talked was this is not affirming, here's how we're going to manage this unfortunate lifestyle that we have, and here are the exercises, and don't hurt yourself. And I understand there's a time and a place for careful, structured exercises, absolutely, but just because you've decided it's not possible to limit the masses on what's possible, when we know there are things like amino acid deficiency, collagen deficiency, mast cell issues that are influencing our collagen and how they're being formed, that can change, that can be modified, that can be helped, even retraining our structure through, I know for me, I did a lot of structural work for my upper cervical, my whole spine, and that helped to stabilize my supposedly forever unstable upper cervical. And I worked with my pelvis, and so there are things. So find somebody who, if you are not happy with what you've been diagnosed with, keep looking. If you're needing somebody to give you hope, keep looking for a practitioner or a person that can give you hope and give you pointers.
And we're not the only ones that are healing. There are lots of people that are healing, and I think more people are starting to share, which is really exciting. More people that are sharing, the better, because one story can only go so far. And so it's just, I've been amazed at how many people have reached out to me to say that they're healing from EDS and from cervical instability. And a lot of common themes seem to be nervous system and diet. Those seem to be really helpful. And
I feel like I just, again, want to say I'm so grateful for the work that you do in the world. And she's going to do an interview too, so you have to check out her YouTube channel. What is it called?
So it'll be on Rachael Elizabeth or at Healing with Rachael.
Okay, so she'll interview me in a minute for a second follow-up. But, when I went through what I went through with my neck, and my daughter at the same time, I knew about you, and I knew about a lot of people. It was so nice just to reach out to you. I had her actually talk with my daughter to help my daughter not take on that imprint that she had just been given, to see hope that, yes, I was just like this and actually worse, and now I'm back living a normal life. And so I feel like my daughter fortunately didn't take in that diagnosis in the way that she would have by meeting somebody, because I can't relate to my daughter in that way. Like, I don't have the loose joints that she has there, but you did. And so I had that too. And I did this and this, and I recovered. And it's just so powerful, which is why I really wanted to have you here. And also, you're just an amazing person, and we're just like kindred spirits, and I adore you. So
thanks so much for having me.
Any last words of wisdom for somebody who is just feeling hopeless in this condition?
Yeah, I would say if you're in a really dark place right now, just know that it can get better, and it will get better, and just keep believing healing is possible. And if that feels too difficult for you, maybe just start with a what if. Start with a curiosity and say, what if I could get better? What if I could heal like this other person I saw on social media that's healing from a similar condition, and what if that could be me? And then start to kind of maybe shift away from chronic illness support groups online and start focusing on listening to recovery stories and following people that are also on the path to healing. And that can be so encouraging and uplifting to have that community, because community is a really good and positive thing. But sometimes when everybody's just sharing about illness and all these negative things and hospital pictures, it can be so triggering, and it can perpetuate that nervous system dysregulation cycle and keep you stuck in chronic illness. And so for me, getting away from that was really, really helpful, and then finding a new community that was working towards healing. And so I'd just say, just keep believing that healing is possible for you.
Well, thank you so much. It's just been such a pleasure. Probably have to have you come in the community sometime and share. We'll have to do a live there. I know a lot of people have lots of questions. So again, her Instagram is at @ribeye_rach. Ribeye, like the steak. Rach. And she always has great content. So thank you for being here. And thank you for going in the hike in the desert.
Yes.
It's the best interview ever.
Yes.